Do you think now, Mr Hancock, that the stay-at-home, protect the NHS, save lives messaging struck the right balance?
Yes.
And why do you say that?
Because we needed to ensure that the public across the whole of the UK understood the importance of staying at home whenever possible in order to stop the spread of the virus.
Do you think now that healthcare workers were kept as safe as possible at work?
Well, it was obviously extremely difficult to keep healthcare workers as safe as possible because effectively the wards of the NHS became the front line in this deadly battle. When I visited hospitals, GP surgeries, pharmacies, as I did regularly throughout the pandemic, I saw for myself. And I did that both publicly but also quietly in order to understand what was happening on the front line. So part of the point of the inquiry is to understand how, as a system, as a country, we can do that as best as we possibly can.
I understand that you say it was difficult, but I want to know, do you think they were, in fact, kept as safe as possible or not?
Well, in the circumstances, facing a pandemic of this scale for the first time in living memory, what I can say accurately is that I and all those around me and the team in the health system did everything we possibly could. Does that mean in a system that employs 1.4 million people in the NHS with another around 2.5 million in social care that every decision was perfect? Of course it wasn't. And part of what we're here to do is to understand how that could be done better.